PREVENA Incision Management System, Mechanism of Action. Despite advancements in surgical procedures to address the needs of a changing population, surgical incision closure techniques utilizing sutures and staples remain conventional practice. In certain high-risk patients and procedures, this surgical technique may lead to post-operative complications and increases in cost of care. Current treatment standards for incision management still rely on conventional dressings such as gauze following primary closure. These traditional dressings are passive therapies that provide minimal protection from external infectious sources. Surgical site infections, or SSIs, represent up to 22% of all healthcare-associated infections. SSIs increase the average length of hospital stay to an extra 9.5 days at an additional cost of $38,000. Similarly, post-operative dehiscence extended the average length of hospital stay by almost 9.5 days at an increased cost of $40,000. The PREVENA Incision Management System manages and protects the surgical incision by helping to hold incision edges together, removing fluids and infectious materials, acting as a barrier to external contamination, and delivering continuous negative pressure at negative 125 millimeters of mercury up to 7 days. The PREVENA Incision Management System is intended to manage surgical incisions that continue to drain following sutured or stapled closure by maintaining a closed environment and removing exudate via the application of negative pressure wound therapy. For surgical procedures that do not require dressing customization, the PREVENA Peel and Place system is available in a variety of sizes. The adhesive film secures the dressing to the site and is easily applied in the operating room. The stabilization layer prevents wrinkling during application to create a robust seal around the environment. The protective shell is flexible to allow the dressing to conform to most surgical locations and acts as a barrier to external contamination. The skin interface layer, which contains 0.019% silver ions, helps control growth in the interface layer and wicks fluid away from the surface. The benefits of PREVENA therapy are not limited to barrier protection of the incision. The foam bolster is engineered specifically to manifold negative 125 millimeters of mercury continuous negative pressure wound therapy evenly across the incision, while conforming to the incision site. For procedures that require customization, the PREVENA Plus system is available to provide greater flexibility for a wide variety of incision lengths and shapes, including linear, non-linear, and intersecting surgical incisions. This flexibility is achieved through a combination of additional features. The foam dressing can be cut for a wide variety of incision shapes and lengths. Hydrocolloid strips secure the dressing to the application site and create a continuous adhesive seal around the edges of the dressing to minimize the potential for leaks. The vac drape covers the foam dressing and adheres to the skin, providing protection from external infectious materials. In addition, the SensorTrack pad and tubing, utilizing SensorTrack technology, connects directly to the PREVENA Plus therapy unit via the PREVENA Plus connector without the need for a vac connector. SensorTrack technology provides continual monitoring and adjustment of negative pressure at the incision site. The 150 milliliter canister allows for increased capacity of exudate storage. Finally, the AC adapter will allow charging of the battery and eliminates the need to replace batteries. To examine the biomechanical changes that occur under PREVENA therapy, computer simulations have been conducted. In the model, an incision in the skin can create uneven distribution of lateral tension around the suture line, forming subcutaneous spaces that may permit fluid accumulation. This may compromise the integrity of the incision. When PREVENA therapy was applied in these computer simulations, there was an elimination of subcutaneous space and about 50% reduction of lateral tension, which helped maintain apposition of the incisional faces. The model also shows the stress distribution in the layers of the skin, which appears similar to normal uninjured tissue. In addition, Porcine studies have demonstrated that the application of PREVENA therapy reduced seroma or hematoma by 63%. The PREVENA Incision Management System is an innovative therapy that covers and protects surgical incisions, holds incision edges together, and removes fluid and infectious material. PREVENA therapy has the most published clinical evidence of any negative pressure incision management system currently on the market, including 5 randomized controlled trials, 4 prospective cohort studies, and 8 retrospective studies. PREVENA therapy, surgical incision protection.